Hey, good afternoon, everyone. We're happy to be with you today for another ACLC webinar. This is an exciting and unique one where we are talking about the product Torch Insight, which is a benefit for people, for members of the ACLC. We brought the two leaders of the organization who run the product on this webinar to talk through things, and we're grateful to hear from them. The agenda, well, I guess before, for those of you logging in, if you will silence your phones, depending if you've come, if you're coming in over the phone or if you're coming through the online platform, you can just, so you can come in by phone, but if you don't, if you can't see the recording, if you aren't able to join, we'll send you a recording. There'll also be time for questions in the last few minutes, so you can pull them up in the Zoom application, and that'll give you the elements there. The agenda for the day is I'll just do a quick something on the announcements for the ACLC events, two of those. One, we do have another webinar tomorrow. That's at 12 p.m. Eastern on the status of Medicaid ACOs. I have a couple really great guests joining that. You can see that in the weekly news and register for it. Also want to remind you to save the date for the ACLC member meeting. We'll have work group meeting on the 23rd, the afternoon of the 23rd, and a plenary on the 24th, and more information coming there. Also want to remind you of work group meetings that are going on. They happen the third Tuesday of every month, so the next one is June 19th. They just reset and have started new topics for each one. They're really doing interesting things. Finance is talking about data needed for negotiating value-based payment contracts, and governance is talking about communication within an org, organizational communication. I think care delivery is talking about developing care teams. So for sure, sign up for those. You can reach out to Jacqueline or Eliza or any of us, and they can help get you registered for those. Okay, I'm going to turn the time over to John Fiacco and Ben Gong. John is the CEO and president of Levitt Partners Insight. He'll be able to give you his background as well as background on the organization. Ben Gong is a product manager at Levitt Partners Insight, and we're glad to have you both with us. John, you want to take it away?
Yeah, thanks very much, John, and thanks everybody for a few minutes of the day today. Yeah, my name is John Fiacco. I lead the Levitt Partners Insight business, which is one of a handful of businesses that are part of the Levitt Partners organization. Levitt Partners Insight was started about 2 years ago, taking the data that Levitt Partners as a consulting organization had acquired, adding to that, and creating a large data warehouse with different windows into that data. My background is in making data, and in particular healthcare data, usable. And I know that in order to use data, you really have to understand what it means. And this is particularly tricky with healthcare information because sometimes it doesn't mean what you might think it means. And so we'll spend the first part of the webinar looking at the version of Torch Insight that y'all have available to you, and going through what those screens are, what that data means, and how you might use it. We'll then spend the second part of the webinar looking at the full Torch Insight product, in particular focusing on the data that we have regarding ACOs and how we're linking that information to those entities that participate in those contracts. With me is Ben Gong, who is the product manager for Torch Insight. He has been on this project since day one. He's screwed it together and he makes it work, and there's nobody better to take you through it, to show you what it can do. So without further ado, Ben, can I turn it over to you and take us through what we have here?
Yeah, absolutely. Thanks, John, for the intro. And thank you for your time in joining the call today. I do want to just mention that the evolution of what we are presenting today and the ACO database and the ACO findings and insight that we've pulled together into a dashboard for all ACLC members is something that has taken a lot of TLC from at Levitt Partners. I've been at the firm for about 5 years, and I was with the firm when we were tracking ACOs in a Google Docs spreadsheet years ago, and essentially just updating that by hand. And we've evolved considerably since then, especially in the last 2 years with the evolution and the outset of Torch Insight. What you're looking at here on the screen that I'm showing is a dashboard that we have put together that helps ACLC members keep tabs on what is happening with value-based care across the country. Now, originally when we were considering ACOs, we were tracking obviously both the public and the commercial contracts and the activity that was happening as we were trying to understand the transition from fee-for-service to value-based care. And we found that over the past 5 years, our evolution of how we think about value-based care has changed quite a bit. What we found is that in order to truly understand this evolution, you have to understand not at the ACO level, not at the organizational level, what is actually happening, but really what's happening at the contract level. You have to be able to drill down into organizations and see what's happening in Medicare and on the commercial side, Medicaid, and so on. Today, what I want to walk you through is what you have available to you that gives you an overview of this transition, and then drill into a few elements that we have that we've built in the last about year and a half, about a year or so, and talk briefly about where we're going in the future in hopes that you'll find this useful and ways to deploy it within your organization. What you're looking at here is our summary table of what is happening with ACOs across the country. You'll see that we have just over 1,000 active ACOs. Now we have tracked, we're obviously tracking those that are going inactive, so our database and the number of ACOs that we've tracked through time is higher than that, but we've just crossed 1,000. We should have some sort of celebration. You'll see that we also have just crossed 33 million for the estimated number of total lives across the country. Now, as I mentioned, we break these numbers down by different types of contracts. So you'll see that we track 1,400 distinct ACO contracts that come from 3 categories: Medicare, Medicaid, and commercial. Now, you'll also see on the right here a trended graph of how that growth has happened over time. We've been tracking this since 2011, and you'll see two lines on this visualization. The first is the total number of ACOs in orange, and the blue is the total number of covered lives. You'll see that the trend is actually fairly consistent, and 2018 is keeping with that trend. We continue to add ACOs. We added quite a few in the last quarter, and a corresponding number of estimated lives, which leads us to that number which I mentioned earlier, just over 33 million lives. I'll take you just on a tour through some of the visualizations below, which if you haven't hopped onto, please feel free to reach out to John or Cambria or Jacqueline, as they'll be able to make sure that you're able to log in and receive these updates real time. Everything that you're seeing here is connected to our cloud-based data warehouse, which we update nightly, and we pull from a number of different data sources. What you're looking at here is ACO growth by type. On the right, you're looking at the number of Medicaid, Medicare, and commercial contracts. On the left, you're looking at the number of lives covered by those distinct types of contracts. What we've done at Levitt Partners is we've found that oftentimes you're able to look at the number of lives, or the ACOs will report the lives associated with a specific contract, and oftentimes they're not. And so we've developed a proprietary algorithm that estimates, based on the provider footprint and the associated providers with that ACO, the true number of lives covered by that ACO contract. And this is important because what we've noticed is that many of the contracts, so even if you have a health system or if you have a hospital that holds a specific contract, not all of their physicians or associated hospitals in the network are part of that ACO contract. And so you have to be very thoughtful about how you're considering who actually touches an ACO contract. You'll see here that although the number of Medicare and commercial live contracts far outstrips the number of Medicaid contracts, but if you flip over to the left, you'll see that the number of lives covered by commercial is quite a bit higher than those covered by Medicare or Medicaid. There's some distinct reasons. Happy to chat about those at another time. I do want to also touch briefly on some of the growth by the payer type and provider type. What you're looking at this visualization on your left is the payment arrangement or value-based contract growth by payer type. And we track that, as I mentioned, Medicaid, commercial, and Medicare. And you'll see that the growth over time is actually fairly consistent. Commercial continues to grow steadily. You'll see that there's it's been fairly consistent over the last 2 years, as well as Medicaid. Now, Medicare contracts sort of come in gross and spurts as a new round of announced every year, and you'll see that we have had this bump recently in February when we added the new round of CMS announced ACOs. Now, the final thing that I'll touch on this dashboard is just being able to visualize where some of these ACOs are. So I'm scrolling down to a map here. It may be fairly overwhelming, but what we found is that it's very helpful to be able to drill into a specific market and begin to understand what's actually going on with the ACOs within a particular area. Now, for any one of these, you're able to hover, identify the ACOs that are in particular within a particular market. But this is where I'd like to jump to speaking of some of the features that we've been working on at Torch Insight for the last year and a half, and how that has really transformed from what you may be more familiar with our original work within the ACC and so on, and talk about how we've changed our thinking and how we've transformed that into a resource that hopefully could be helpful to you. What I'm going to do is I'm going to switch tabs here and jump into another geographic representation of ACOs across the US. Now, what you're looking at here is the percent of the population that is covered by an ACO life, red being high, blue being lower. I'm going to take this opportunity to layer on all of the ACOs across the country. Now, this will be a fairly similar representation where you have quite a few. And so I'm going to drill into the Northeast to show you a way to drill into these ACOs and begin to gather some additional intelligence about both the market and how an ACO is actually operating. For this instance, let's take Northwell Health. And what we've built out is a way that links the ACO data to other elements within the databases that we have at Torch Insight, which holds the quantitative IP of Levitt Partners. Here you'll see a snapshot of the actual ACO, some of the general information, estimated lives, a maturity score that we've generated at Levitt Partners that helps you rank ACOs on how mature they are relative to others, and some of their associations. You can also drill in here, and this is an element that we found to be very helpful in aggregating intelligence about an ACO organization. This will give you an overview of the ACO and provide some additional metrics about its individual payment arrangements. We'll be expanding into, we're pulling additional data that we have at Levitt Partners onto these constantly. I'll mention bundled payments. We've done quite a bit of work there, and this is data that's making its way out into this user-friendly platform. Now, on the left, you've got an overview of the actual ACO. We've taken a lot of time here. We gathered this data through interviews, through surveys, through web scraping. We have an ACO team on the consulting side, and Torch Insight is just about to approach 20 full-time employees. And so we've invested a lot of resources into refining this data and bringing this intelligence around value-based care to you. We also bring a number of metrics that may be helpful in understanding the organization. And this is where I think that the Levitt Partners intelligence really shines. You'll see here that we have the estimated covered lives, which I mentioned earlier. That's an aggregate of all of the contracts that this ACO Northwell Health holds. We also have a maturity score that we generate, which I mentioned briefly before. This is a score that we generate based on 3 metrics: the time they've spent in accountable care, the number of contracts that they hold, and the highest risk level of those contracts. We also identified the number of Medicare contracts, active contracts, Medicaid contracts, and commercial contracts, which I'll touch on briefly. On the right here, you'll see the associations for Northwell Health. And what that means is we've identified the hospitals that are affiliated with this particular ACO. Anything that's orange and hyperlinked, you can drill down deeper into, which I'll also speak to briefly. You'll see that we've identified the insurance carriers that are also affiliated with the ACO in some form or fashion, as well as the physician groups. Now, as well as key ACO contacts, which you may be interested in if you're looking to reach out to the ACO. Now, down below, you'll see the metrics for the individual contracts, what we call payment arrangements. Here, you'll see those 6 commercial contracts and 1 Medicare contract. You'll see the CMS program that they're part of. Obviously, the commercial contracts aren't part of a CMS program, but you'll see that Northwell has been participating in MSSP Track 1. You'll be able to see the covered lives by contract, as well as the carrier that's involved with each one of these contracts. Down below, we also have been tracking and pulled in the MSSP results over time related to that particular contract. Here you see they've reported numbers for 2016 and including their total benchmark expenditures, the generated savings and losses, and so on. From here, we have a number of things that are quite helpful as you're considering both network and performance. For each one of these, you can drill into associated providers. Here, I'm going to drill into North Shore University Hospital. This will pull up our hospital dashboard, which links into our hospital database. On the left, you'll see, similar to the ACO, general metrics about the hospital itself: bed count, type, discharges, patient mix, patient star rating, hospital star rating, and so on. We've spent a lot of time drilling into the individual data sources for these, pulling together a blended product, and then we provide clarity into where these metrics are coming from for whatever type of analysis you're doing. In this case, the employees is coming from Medicare cost reports. We have that data from 2010 to 2016, and we've touched it just over 3 months ago. You'll see that we have financial data, market share data, clinical measures, and so on for the hospitals. And all this is geared towards understanding healthcare markets. At Levitt Partners, we found that in order to understand ACOs and the markets in general, you have to understand the broader context, who they're affiliated with, and how they're performing. Similar to the ACOs, you'll see that we've affiliated the individual hospitals with physician groups, and we've identified those that are the most important to the hospital by referral volume. ACOs that they're part of, in this case, you'll see that North Shore is just affiliated with Northwell Health, as well as contacts for the hospital itself. Now, we do have trended information. You can query this data out, pull it down in Excel spreadsheets, which we found to be quite helpful as you're considering doing benchmarking or identifying organizations, building a cohort that may be similar to yours or a market that you're interested in. I'll touch on one more element here within the hospital dashboard, and then I'll pause. We've also built out at Torch Insight a number of analytic tools that help you understand both the organization at a deeper level as well as the market that they're operating in. Now, the value of what we've done here is we've taken public data that we license, and proprietary Levitt Partners data and pulled it into one place and linked it together. The goal is to save you time and provide insight that you couldn't get from disparate data sources. One of these is called our patient flow tool. Now, what this is a tool that allows you to visualize where patients are coming from and where they go to once they interact with a particular entity. When I say entity, I mean an organization, in this case, North Shore University Hospital. We're pulling this from Medicare claims data at the patient level. And what this allows you to do is identify, in fact, I might zoom in here. North Shore is a fairly complicated provider system. What it allows you to do is identify where patients are coming from. In this case, the vast majority are coming from their home before they interact with North Shore. But you can also identify the home health agencies, the other hospitals, the nursing facilities, and so on, that are sending patients to North Shore, as well as the associated volume. Once they interact or have an experience at North Shore, you can then see where the patient goes from there. In this case, you can see that the #1 partner for North Shore is called North Shore Home Care. It's a home health agency. You can also see the volume associated with that. And again, you can sort of drill down and see the other facilities where this hospital is sending patients, whether that be SNFs or other hospitals and so on. Now, from there, you can also see where North Shore Home Care is sending their patients. We call this the flow through the market, and you'll see that one of the largest places where they actually send their patients is right back into North Shore University Hospital. Now, I think that there are a lot of applications here, and we're taking this a few steps further in the next few months. This is very helpful in terms of partner identification, in terms of understanding the market, in terms of understanding the flow of patients. Now, the next steps that we'll be taking on this tool is that you'll be able to drill down by a specific DRG, a specific ICD, be able to drill down by a service line, and then be able to segment by health system. We think this is going to be very helpful in terms of identifying leakage and where patients are jumping systems and so on. If you're interested in this, please feel free to email John, Cambria, or Jacqueline, and we'll be happy to get in touch and answer any questions that you have. Let's see, the final metric that I'd like to touch on actually comes back to, I'm going to come back to the hospital dashboard and spend a moment talking about the data elements and how the interconnectedness between these groups. Sorry, I'll come back to the ACO dashboard. So back on Ortho Health, you'll see that what I did was I took one element, the hospital component of the ACOs, and did a deep drill down to understand what's really going on with that hospital. You'll see that we have these associations and this drill down capability for each of the different groups that we have, whether that be payer, where we have a full payer database that we have in-house. We're very proud of it. We spend a lot of time integrating different data sets. On the consulting side, as we've worked through different client deliverables, we found that there are holes in different data sets, and we've spent a lot of time patching those and figuring out which ones to trust and so on. And we've pulled that into a single source of truth here. You can also drill into physician groups, whether that be individual physician practices or whatnot. For any one of these, you can also drill in. I'll open a separate tab here into the physician group side, and you'll see that we have similar information on the physician group organization. Here in the left, you'll have some of the general information about the organization, its size, its primary specialty, the percentage of the providers of that group that are in orthopedic surgery in this case, and so on. On the right, you'll see who this physician group is affiliated with. Now, we're pulling this from, again, commercial claims. So we call this, the foot traffic affiliation. This is not ownership. This is where they're actually sending patients. So curiously enough, this is a really interesting physician group because they're splitting. It's about a size of 24. We adjust it because there's a lot of double counting in the original data sources, and they're splitting their patients between Catholic Health Services and Northwell Health. You can also identify the individual hospitals where they're sending their patients, as well as an estimated % of the total volume. We have the ACOs that this physician group is affiliated with, in this case, just Northwell Health, as well as the individual providers that make up that group. And that includes their name, credential, NPI, and we'll be bringing more information at the provider level to the platform. We're really excited about this. We think that the framework for Torch Insight allows for some really robust analysis. It goes from being a data resource that allows you to tap into a place where the data is centralized and maintained, all the way to some custom analytics that help you understand where patients are going. We'll be looking at readmissions by service line and so on, as I mentioned. So we're really excited. This platform is something that we've invested a lot of time into and has evolved considerably from what it was even just a year ago. And with that, I'm going to pause and John, kick it back to you to see if there are any questions that have come through and spend the last few minutes on Q&A.
Great, thanks, thanks Ben, appreciate that overview. And John, just really exciting stuff what you guys have all put together. There's a question box you can answer. I'll make a comment and then we do have one question in. So the first dashboard you showed on what the ACLC members have access to, I just want to clarify for people, it's updated daily, and people are more than welcome to take screenshots of that or extract that data and use in presentations you might have internally and externally in your companies. We know oftentimes we're looking for those additional resources that you're more than welcome to use, and hope you will with attribution. Ben and John, we recognize the great resources that have gone into all the other elements, and while not every ACLC member has access to those, I did want to mention that we extract a lot of this knowledge and put it into a report and analysis that we are doing on behalf of members. The one question, Julian from Hanover Re, I think we answered most of that, or at least part of it, that the data, the ACO data does include next gens, not just MSSPs, really ACOs of all types, and that it does identify when an ACO is in a specific MSSP track. Ben, is that data also, is it aggregated? So the question that Julian asked is so we can see the percentage of MSSPs that are taking downside risk. Does it summarize that data, or is that something you'd need to export and do on your own analysis?
That's a great question. That makes sense. So within Torch Insight, I think so. So we capture all of the data and the type of risk that that ACO bears at the contract level. So an individual ACO may have one or two contracts if they're involved in, next gen or whatever the program may be. We maintain that data within Torch Insight and can report that at the ACO level, at the contract level, or at an aggregate report for a market or a number of ACOs.
Got it. Great. Julian, let me know if that doesn't answer your question. Any other questions? I don't see come in. We didn't have a lot of time here, and we can wrap up. One question I did have that I've heard before, Ben, is your sources for this. Clearly, you mentioned Medicare claims data. Some of this comes from other reports out of CMS, but where do you collect all this from?
Yeah, great question. So we pull from about 75 distinct data sources and manage that all on the back end, and there are three types. The first is publicly available data that you could go out and download. It may be ugly, it may be a pain to get to, but that's something that you can manhandle and pull in. The second is data that we license at Levitt Partners. This is through partnerships that we have where we are able to extract data from different organizations and build it into our tool, blend it, and so on. And the third data resource is data that we generate at Levitt Partners, whether that be through generated metrics or surveys or interviews that we run ourselves. Within any one of those buckets, we have a number of different data sources. So on the public side, we hit Medicare cost reports, we do a lot from CMS, we have census data, we have American Community Survey, BRFIS, and so on. From the licensed data, we license Medicare data. We work with the National Association of Insurance Commissioners. We work with another organization that provides contact information, another organization that provides news updates. So there's sort of a whole bucket there. And then the final side, on the Levitt Partner side, we, as I mentioned, draw from surveys that we run ourselves internally. We have our ACO team that's interacting with ACOs constantly, both doing case studies and other interactions. And then we have a full team that is involved in our web scraping and web tracking efforts to pull that data in.
Awesome. Thank you. We're at the end of our time. For those of you who don't have your account set up on Torch Insight for members, you can email any of us the names, but also members@accountablecarelc.org. We'll get you there. I think that email's coming up on the screen here. So for sure, also, if you have interest in talking to Ben or John about additional access to the other elements, we'd more than you can reach out to us in whatever way. Appreciate everyone's time here. Come back and join the webinar tomorrow on Medicaid ACOs and reach out with any additional questions. So thank you, Ben. Thank you, John. And thank you all for joining.